Welcome to An Apple a Day, a podcast, a resource, a community. Share your experiences and learn from others as we overcome barriers and learn to live a happy, healthy life with a disability. Welcome to the community. Here's your host, Jimmy Apple.
Welcome to the latest episode of An Apple a Day. I'm your host, Jimmy Apple. An Apple a Day is brought to you by www.famousapple.com. Famousapple.com is the home site for this podcast, so if you get a minute, go over there, check it out. Also, while you're flipping around the web there, I want you to stop by our group page on Facebook. It's at www.facebook.com/groups/disabled living. That's going to bring you to a page that says Living with a Disability. That's an Apple a Day group page. You're going to enjoy it over there. We have 84 members right now, and it's growing every day. Every day we have new members. As a matter of fact, right before I came into the studio to tape today, I just approved another new member. And they're from all over the world. And speaking of from all over the world, we're up to 78 countries. That's right, 78 countries are listening to us every week. Every week we have 78 countries downloading the podcast. The numbers have been phenomenal. It's been a slow growth over the last 3 years, but all of a sudden we're going through the roof, and it's great. We're getting feedback from all over. I was talking the other day with people from Belgium, from Africa, from India, of course here in the U.S. We have friends in Canada that we speak to on a regular basis. It's amazing. And if you don't stop by the group page and join in, you're missing out. You're missing out on meeting people that you probably would have never, ever met before. Or you would have never met them anywhere else other than on that page. And you know what the thing is? We're all in the same boat. Whether we're disabled, or we have a disability, or somebody that's helping other people with a disability. But the thing is, we're all in that same community, the disabled community. And we're all giving each other a hand up. You know, nobody's feeling bad for themselves. Everyone's got some positive things to say. Some people have questions. Some people have answers for them. There's debates going on. We've had a couple of good conversations going on over there, and you want to just jump in. It doesn't matter if you weren't in there for the beginning. You have something to add to a conversation, just jump in and add to it. It's welcome. It's a welcoming place, and the people are very friendly. So if you get a minute, go over to www.facebook.com/groups/disabled living, and that'll bring you to Living with a Disability. So, how you feeling today, my friends? You feeling good? You feeling strong? You feeling better than you did yesterday? Excellent. Hey, this COVID-19 is making its second round. If you look at the numbers in the news, all across the United States, all around the world, numbers are going back up again. And you know why? My theory is, people have gotten lax. They think that, well, it's fading away, and who doesn't want to wear a mask, and who's not going to wear a mask, and it's such bullshit. Wear the damn masks. Wear the gloves. Take the same precautions. We're falling right back into this cool weather, and this is where it all started last year, the beginning of this year, in the cool weather. You have to take the same precautions. It's not over. It's not over by a long shot. And the people that say, well, I don't believe in wearing a mask. This is America. I'm a free person. Nobody can make me wear a mask. Well, you're an idiot. Plain and simple. The mask isn't for you anyway. The mask is to protect other people from you. It's a courtesy. It's a common courtesy towards your fellow man. And you know, the funny thing is, and I said this before, the maniacs that don't want to wear a mask because they feel like it bothers them or something, or it's their right not to wear a mask, are the same maniacs that'll complain about people who smoke, and they don't want to be around people with secondhand smoke. Well, you can't have it both ways. So if you don't want to wear a mask, I'm sure you're not going to be bothered if we get into an elevator, you and I and I take out a cigar and light it and smoke it all the way up to the 100th floor. That won't bother you, I'm sure. Or if we're in a restaurant and I'm sitting at a table next to you and I light up my foot-long stogie, it's not going to bother you if I smoke all through dinner. Will it? Oh, if it does, it's my right. I'm an American. It's a legal product. Don't make excuses for being a jackass. Wear the mask. Now I see that they're opening up movie theaters here in New York. I think they've lost their mind. I think their mind has gone to mush. Because why? What is essential about a movie theater? Now, I'm sorry. I know people own movie theaters and I don't want to see them lose their business or go out of business, but I don't want to see people lose their lives over a movie. But here in New York, upstate New York, they're opening up these movie theaters and they're saying you have to wear a mask to go in, and they have to social distance, and they're taping off seats and all this other nonsense. But you can take your mask off to eat popcorn. People, cable TV has pay-per-view. Number one, pay-per-view is cheaper than going to a movie theater. Pay-per-view is safer than going to a movie theater. Pay-per-view is more comfortable than going to a movie theater. I don't understand. What's the demand that you have to go to a movie theater? I don't understand it. And I don't understand what this whole thing is with, I need to go to a restaurant. I have to go to a restaurant. I'm dying to go to a restaurant. I read Facebook every day. I've read it every day during the pandemic, during the lockdown. And these are the things that people are saying, oh, I miss going to such and such a restaurant. I miss going here. What is the need to go to a restaurant or go to a movie theater? You have a kitchen. You have a stove. You have pots and pans. You have all the time on your hands right now because of the pandemic and because of the lockdown. Learn how to cook. What's this takeout orders and you have to have the food from this restaurant? You can't make your own food? And think about it. Pay-per-view movies. If you go to a movie theater, you're sitting in a chair with 100 other people in the movie theater. Here you can rent the movie. You can sit in your pajamas. You can make yourself a nice cocktail, you and your friend, and you can sit back, relax. If you want to get up and go use the bathroom, you can pause the movie. It's so much more comfortable at home. Why the necessity to go to a movie theater? Doesn't make sense. Not to me. But anyway, we got a good one for you today. And it's a lot of information. Number one, about Medicare, because this is the time of year that the open enrollment to get these Medicare plans. So we got some information about that. And I have some information about the second wave of COVID-19, the coronavirus. I told you it was coming, and I think I have some proof that it's on its way. So sit back. I tell you to relax, but this is too important to relax. Sit back and listen. Let's get started. I'm sure most people who receive Social Security disability realize that they're also eligible for Medicare. If you're not receiving Medicare and you're interested in it, you can go to www.ssa.gov and look up Medicare. But what I want to let you know is that you can apply for Medicare online by going to www.ssa.gov. Now, here's something else for those who do receive Medicare. Some Medicare beneficiaries may qualify for extra help with their Medicare prescription drug plan costs. To qualify for the extra help, a person must be receiving Medicare, have limited resources and income, and reside in one of the 50 states or the District of Columbia. Read Understanding the Extra Help with Medicare Prescription Drug Costs for more information at www.ssa.gov. If you're struggling with your prescriptions and you have the limited income, try it out. Get some help with it. Don't make yourself have to make a decision between not eating and not taking your pills. Very important that you do both. So there's help out there for you if you're struggling with your prescriptions. Now, one of the things I also want to share with you here, this is right from Social Security. This says your health insurance coverage. Medicare is our country's health insurance program for people age 65 and older. Certain people younger than 65 can qualify for Medicare too, including those with disabilities and those who have permanent kidney disease. The program helps with the cost of health care, but it does not cover all medical expenses or the cost of long-term care. You have a choice for how you get Medicare coverage. If you choose to have original Medicare Part A and Part B coverage, you can buy a Medicare Supplement Insurance or Medigap policy from a private insurance company. Parts of Medicare. Social Security enrolls you in the original Medicare Part A and Part B. Medicare Part A, hospital insurance, helps pay for inpatient care in a hospital or limited time at a skilled nursing facility following a hospital stay. Part A also pays for some home health care and hospice care. Medicare Part B, medical insurance, helps pay for services from doctors and other health care providers, outpatient care, home health care, durable medical equipment, and some preventive services. Other parts of Medicare are run by private insurance companies that follow rules set by Medicare. Supplemental or Medigap policies help pay Medicare out-of-pocket co-payment, co-insurance, and deductible expenses. Medicare Advantage plans, previously known as Part C, include all health benefits and services covered under Part A and Part B, prescription drugs, and additional benefits such as vision, hearing, and dental bundled together in one plan. Medicare Part D, Medicare prescription drug coverage, helps cover the cost of prescription drugs. Most people aged 65 and older are eligible for free medical health hospital insurance Part A if they worked and paid Medicare taxes long enough. You can enroll in Medicare medical insurance Part B by paying a monthly premium. Some beneficiaries with higher income will pay a higher monthly Part B premium. To learn more, read Medicare Premiums Rules for Higher Income Beneficiaries. Take a look at www.ssa.gov and check out the information on Medicare. This is the time that you can change into some of these private plans that can save you money, give you better benefits than just plain Medicare. And in the long run, you're going to save money. All right, so your premium may go up monthly by a couple of bucks. For instance, I did a couple of years ago, I took on a Humana plan. And I have to tell you, for me, Humana was perfect because I have long stays in the hospitals at times. So it cut my costs down tremendously. But then my wife's job changed and I was able to be covered under her insurance, so I was able to cut that out. But that program, and now I'm not advertising for Humana. I'm just saying my experience with Humana was very good. And the perks and benefits that came along with that plan were excellent. But there's a lot of great plans out there. And you should have gotten that white book by now, your Medicare book. Look through it. Look at some of the plans. Don't go by the commercials that you see on TV right now, because they're like used car salesmen. They'll sell you anything. Look for yourself. Do your due diligence. Do your homework. Look through these plans. Some of them are great. Some of them are terrible. I'll be honest with you. Some of them are very expensive. And the ones that tell you, well, there's no premium. Yeah, there's no premium for a reason, because there's no benefit to them. But remember this. Whatever you pick at this point, after the end period here, you're stuck with that insurance till next October. So keep that in mind. Okay? All right, let's move on here. Well, I hate to say I told you so, but I told you so. COVID-19, the coronavirus, this vile, disgusting, deadly disease is coming back for round 2. Governor Cuomo in New York State, he just came up with this genius idea that anyone entering the state now, anyone entering New York State has to have a COVID test. Then they have to quarantine for 3 days. Then they have to take another COVID test. But what if they refuse to take the test, right? Then they have, if they want to come into the state, they have to quarantine for 14 days. So then I started thinking, but what about the people that work in New York that come in from New Jersey and Connecticut and Pennsylvania? No. That doesn't matter. They don't have to do this. What? So you're going to half-ass it. What about the people that come from Maryland into Pennsylvania and then they decide to come to New York? And it makes no sense. Then they're making half-ass rules. Make a rule, stick to it. This is the same thing. Boris Johnson, all right? UK Prime Minister Boris Johnson on Saturday announced a new month-long lockdown for England as COVID-19 cases surge across the country. That's right. He is closing down the country for a month, starting November 5th to December 2nd. But this, again, makes no sense. Why do things half-assed? They'll close down this. Now they're going to close down the country, except they're going to send the kids to school still. They're going to close the restaurants, the pubs, and the bars, except for takeout. You can have takeout out of the clubs and the bars. This makes no sense. Why would you send the kids to school? Why not just do the remote learning? Shut it down. Don't take any risks. Everything's done half-assed. It makes absolutely no sense to me. Johnson says residents will be required to stay home except for education, work that cannot be done from home, exercise, recreation outdoors, medical appointments, or to shop for essentials or care for others. Pubs, restaurants will have to close except for takeout and delivery. Supermarkets will stay open. It just makes no sense. Stick it out for the month. It's a pain in the ass. Everybody knows it's a pain in the ass. We've all been through it. But just stick it out for a month. Nip this in the bud. Now, it's not just in England. Wales has had a lockdown for a week already. Ireland, France, Belgium, Italy, and other European countries are also in various stages of lockdown as virus cases skyrocketed through Europe. We're getting hit with a second phase here. And yet, people here, they're still fighting about not wanting to wear a mask. This is unbelievable. We all have to do it. It's not a matter of this country's going to do it, but this country isn't. This state in the United States is going to do it, but this state isn't. It's got to be everyone all at one time. Do it. Be done with it. If we all did it at one time, instead of this piecemeal crap, we all did it at one time, we could probably knock this virus right out. And now, to even more proof that this is coming back, here's an article that was in the newspaper, in the New York Post. It says how to protect yourself when someone in your home has COVID-19. COVID-19 infection can spread quickly and easily in a household, but there are some measures that will help stop the transmission of the bug, a new study says. Persons who suspect that they might have COVID-19 should isolate, stay at home, and use a separate bedroom and bathroom if feasible, according to the study, which was supported by Centers for Disease Control and Prevention. The isolation should take place immediately, even before getting test results, the study says. Delaying the isolation until confirmation of infection could miss an opportunity to reduce transmission to others. The authors also recommend that everyone in the house wears masks when they're within the same space. The study found that 75% of secondary infections were identified within 5 days of the first patient getting sick. Transmission was frequent from both children and adults. Children and adults. And England there is going to send the kids to school when they see a surge in COVID-19 cases. I just don't believe it. Please, everybody has to be smart about this. As I said, we can't do this piecemeal. We cannot do this piecemeal. We're seeing the numbers in New York. You hear Governor Cuomo telling us, oh, everything's looking good and we're looking great. We're looking great. But if you watch the news here, numbers are going up and they're going down, up and down. It's like a roller coaster every day. All right, they're not jumping to the numbers yet like it was when we were in the middle of the pandemic, but they're jumping higher, jumping low, jumping higher, and then a little lower, then higher and higher. The numbers keep going up. That's the bad thing. That's the scary thing. And in the meantime, they're still trying to open up things like movie theaters. Oh, that just burns me. And they have these laws. You have to wear a mask. You have to wear a mask in public. Do they enforce the laws? No. They have to start enforcing the laws. I'm not one for Big Brother looking over your shoulder for every little thing you do, but you know what? We're talking about life and death at this point, and I think it's very important. I think it's very important you go into a store, into a supermarket, into any public space where you see people not wearing a mask, that you get on your cell phone and you call 911 and say there's people here not wearing masks. Like that old saying, the squeaky wheel gets the grease. Enough people complaining about it, maybe law enforcement will take action. But we're talking life and death here. We're not talking about party hats or anything like that. We're talking about life and death. Please wear a mask, be safe, be sensible. Take care of yourself, take care of your family, take care of your neighbors, your friends, take care of yourself and take care of others. Wear the mask, please. Let's move on here. I want to thank you for stopping by today, and I want to remind you, things can always be worse. No matter what, there's someone somewhere right now wishing that they were in your position. But things can always be worse, my friends. Hey, I want to see you back here again during the week because there's exciting things going to be happening over the next few weeks. We're into the holiday season and we have some important guests gonna come here and talk with us. You're not going to want to miss it. So stay safe, wear your masks, take care of each other, take care of your families, and I'll talk to you during the week. You've been listening to An Apple a Day. My name is Jimmy Apple, and remember, the best medicine for everything and anything that bothers you is laughter.
Thanks for listening to An Apple a Day with Jimmy Apple, your gateway to a happy, healthy life. Join our community at www.famousapple.com. See you next time.